Hi there, my name is Melissa. I'll be your nurse today. I'll start off with washing my hands. So today we're going to be doing a comprehensive physical examination. So I'm just going to jump right in. If you have any questions or if you feel anything that's abnormal or any tenderness or anything like that, just go ahead and let me know. And we'll go ahead and get started. We're going to just do a full head to toe, just a skin evaluation. I'll start by looking at your face. I'm looking at the texture, the skin integrity. I'm looking for any bruises or any masses or skin lesions or rashes or any nevi, anything that's just abnormal for me. And then also, as I go through this, I'm going to palpate and I'm going to feel your skin turgor, and I'm going to feel temperature, and I'll feel that bilaterally. And then I will check your skin turgor here on your hand, and I'll do that bilaterally. And it looks like you are well hydrated. Any nevi that you would have, I would check, and I see that there is like a couple here, one over here. I would check using the ABCDE method, and it would be checking asymmetry, your border of the nevi here, and then I would check the color. I would check the diameter and make sure that it's no bigger than 6 centimeters in diameter, and then also checking for any elevation, which none of that is of concern with those ones. I'm also going to feel down here in your legs, checking the temperature, making sure that you have good skin turgor down here in your feet. I'm also looking for any varicosities. I'm feeling for any edema, and none of that is here. I'm also looking at your hair distribution while I'm down here too, and it's a normal male hair distribution. Now I'm going to go ahead and move back to your head. What I'm going to do is first just be inspecting, and I don't see anything abnormal. It's all symmetrical. I'm going to go ahead and palpate, and you do have a normal male hair distribution in your head, on your head as well. And I'm just feeling for any masses or bumps, looking for any bruises or anything that would be of concern. All right. So next we're going to do a few tests. What I'm going to be looking for is, one is testing cranial nerve 7, which is the trigeminal, and that's looking at some things on your face. One of them is going to be testing your sensory function, and I'm going to go ahead and check your ophthalmic, maxillary, and mandibular sections of your face, and it's going to be checking for sensation. So what I'm going to do is just touch your face with either the soft or the sharp side, and just go ahead and let me know if you feel sharp or a dull sensation. Okay, go ahead and close your eyes.
Dull. Sharp. 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 Dull. Dull. Dull.
All right. I'm also going to check a few motor functions with that nerve as well. I'm going to check your temporal mandibular joint right here. I'm going to have you go ahead and open and close your mouth a few times. I'm feeling for the movement and seeing if there's any click or crepitus or anything of concern. And there's not. I'm also going to test and see your muscle strength. So I'm going to have you go ahead and turn your head into my hand, and we're just checking your muscle strength against resistance. Go ahead and move the other way. All right, I'm going to have you push down, and then try to push up. All right, excellent. I'm going to check your cranial nerve number 5, which is your facial nerve. I'm going to have you go ahead and smile. I'm going to have you frown. Go ahead and puff out your cheeks. Show me your teeth. All right, go ahead and close your eyes tightly. I'm going to try to open up your eyelids against resistance. All right, very good. Let's see. Next, we're gonna check a few things with your cranial nerve number 2, and that is gonna be a couple tests would be the Snellen and the Rosenbaum test. So usually with the Snellen test, we would use a chart and you would stand 20 feet away. But with this one, we have it specifically designed where you can stand 6 feet away and do this one. I'm going to have you go ahead and just pick which is how low you can read, which is the lowest line you can read, and go ahead and cover one eye. And if you were wearing glasses or contacts, I would test you with and without, but since you're not, then I'm just going to go ahead and test you with how your eyes are right now. So just let me know which line do you think is the lowest one that you can read.
One more down from that.
All right.
CFDHJ.
All right. Do you want to try this one?
LTFPH.
All right. And that is very good. That's a 20/20 vision. Do you want to go ahead and cover your other eye? And which one do you want me to go at?
Yeah, we can just do the LTFPH, the bottom one.
Okay, the bottom one. All right, perfect. And that is 20/20 vision. This one is checking more nearsighted vision, and this is the Rosenbaum test. And this one you hold about 14 inches away from your face, and then go ahead and cover one eye. And what line do you want me to go at here?
And go lower.
All right.
We'll do one more. 937826.
All right. Do you want to try a lower one or?
No.
No? Okay. Try your other eye.
And 937826.
All right, and that's about 20/25 for both of those. We're going to move on and test a few more cranial nerves. We're going to test cranial nerve 3, 4, and 6, which are your ocular motor, your trochlear, and then also your abducens. So one of those that we're going to test is going to be just looking at your 6 cardinal gaze points here. So what we're going to do is I'm just going to have you go ahead and follow my finger as I do this, okay? I'm just looking for normal eye movement. We don't want to see any nystagmus or anything out of the ordinary. All right. Also, we're going to do a cover-uncover test, and I'm going to have you hold this over one of your eyes. Actually, what I think I'm going to do is just go ahead and have you cover it with your hand. Then it can get a little bit darker there. All right, so go ahead and uncover that. All right, go ahead and do that again. And then go ahead and do the other side now. All right, and I'm just looking at the reaction of your pupils as you're doing that. Also, I'm going to, and this is testing cranial nerve number 2 as well. I'm going to also just have you go ahead and look at a point straight ahead, and I'm going to look at your pupils right now. Just checking your reflex. All right, excellent. We're going to look a little bit further into the inner eye, and I'm going to use this ophthalmoscope here. What I'm going to be looking at is for a red reflex, and I'll be looking at the optic disc. I'll be looking at the blood vessels inside of your eyes, and just looking at the macula and the fovea, multiple different structures of your eye. All right, perfect. Also, I'm just going to go ahead and palpate around your eyes, and I'm going to be looking at a few different structures. One of them I'm going to be palpating is the paranasal sinuses here, and then also the lacrimal sac. What I'm gonna do, if you feel any tenderness, just let me know. I'm gonna also pull down your eyelids and then look at your conjunctiva and make sure that they're nice and pink and well hydrated. I'm just palpating your eyebrows and your eyelids, looking for any lid lag or anything like that. Looking at your eyelashes, just making sure that there's nothing abnormal with the eye area. I'm also looking at the sclera, looking at the pupil, the iris, just the whole body of the eye as we go through this. I'm going to go ahead and move on to cranial nerve number 8, which is the acoustic, which is for your ears. I'm going to start with just going ahead and palpating the external meatus here around the auricle, making sure that there's no tenderness or anything that would be an obvious issue. All right, and then I'm going to go ahead and look on the inside of the ear. What I'm going to have you do is slide a little bit closer here so I can get a good look. I want to look at the tympanic membrane inside of your ear. I'm looking at just all the different structures on the inside of your ear. I'm also going to go ahead and do a few exams for the acoustic cranial nerve, and I'm going to do a whisper test, and I'll also do a Weber and Rhine test. What I'm going to do first is the whisper test. I'm going to come around behind you, and I'm going to whisper on one side or the other. I'll just say a word quietly, and I want you to let me know what ear you hear that in, and then also what word it is, okay?
Waterfall on my left side. Rain on my right side.
All right, and then we're gonna go ahead and do that Weber and Rhine test that I had talked about. What I'm gonna do first is I'm going to go ahead and hold it on a bony prominence, and then also I'll go ahead and hold it on the outside of your ear. Just let me know when you can no longer hear or feel the vibration, and then when I hold it to the side, let me know when you can no longer hear the vibration, okay?
No. No.
All right.
That one's going for a long time.
That was a good one.
No. No.
All right, and then I'm gonna go ahead and do that on top of your head here. Just let me know when you can't feel the vibration anymore.
No.
All right. Now we're gonna move on and we're going to test cranial nerve number 1, which is the olfactory nerve. What I'm going to have you do is close your eyes and hold one nostril closed, and I'm going to have a couple scents that I'm going to hold underneath of your nose, and I want you to let me know which one that you smell, okay?
Vanilla.
Go ahead and sniff again.
Cinnamon.
All right. I'm going to have you keep your eyes closed and go ahead and do that to the other nostril.
Cinnamon.
And then go ahead and sniff one more time.
Vanilla.
All right. I'm also going to look at the structures of your nose. I want to have you tip your head backwards. I just want to look at the septum, make sure that that is patent. I just want to feel your nose area here. All right. Also, I'm going to check your mouth and your pharynx. I want you to open up wide, and I'm just going to go ahead and check a few structures on the inside of your mouth, okay? What I'm looking at is your teeth. I'm going to go ahead and count those. Make sure, I do see that your wisdom teeth are removed. And I'm also looking at to check if there's any fillings or dental caries. You do have a few fillings, but I don't see any visible deterioration of any of the other teeth that you have. I'm also looking at your gums. I'm looking at the gum color. I'm looking at making sure that there's no white patches on your tongue or the inside of your mouth at all, or on your gums, making sure that there's no patches or anything like that. I'm also going to check your Wharton's and Stenson's ducts on the inside of your mouth. I'm just going to go ahead and pull these out a little bit here. I'm also going to check the frenulum up on the top here in your upper lip. I'm also going to go ahead and test cranial nerve number 9, which is your glossopharyngeal nerve. I'm going to have you open your mouth wide and say, ah. All right, and what I'm looking at is the uvula. Go ahead and keep your mouth open. I also want to look at your tonsils in there as well. And then to test cranial nerve number 10, what we would be looking at is your speech, your gag reflex, and just a few things with that to make sure you're able to swallow well, and that would test your vagus nerve, cranial nerve number 10. I'm also going to have you go ahead and I'm going to test cranial nerve number 12, which is your hypoglossal nerve. I'm going to have you stick your tongue way out, and I'm going to have you move it to the right and the left and up and down. Just make sure that you have good control over that. All right. I'm also going to do another one, which is your cranial nerve number 12, which is your spinal accessory nerve. What I'm going to have you do is go ahead and shrug your shoulders against resistance. All right. Then I'm going to go ahead and check your spine here. And then I'm going to go ahead and inspect more of your neck area. There's a few nodes that I would like to check, your pre and post auricular nodes. And then I'll move back I'm just looking to make sure that they're not hard and that they're just nice and soft, that they're not tender. I'm going to check your occipital nodes as well. All right, and then I'm going to move down here to your tonsillar nodes. All right, and then I'll check your clavicular nodes here. All right. I'm also just going to go ahead and palpate over your carotid arteries and also over your thyroid. And I'm looking at your trachea while I'm doing this. I'm also going to have you go ahead and tip your head back and go ahead and swallow. All right, and I'm just looking at your thyroid here. I'm also going to listen over your thyroid and your carotid arteries just to make sure that there's no bruit. All right. So next, I'm going to do a few exercises. I want to check your musculoskeletal system, so I'm going to have you go ahead and stand up. I think, let's see, I just want to make sure that we're in the camera. Go ahead and move up here a little bit. I'm going to have you bend all the way over and touch your toes, and I'm going to check your spine as we're doing this, making sure that there's no scoliosis or anything. Just checking your cervical spinous, making sure that you have good hip flexion here. All right, go ahead and stand up. I'm going to have us move back over here so that we're still in the camera. Go ahead and stand sideways here. All right, so now I'm just going to go ahead and check all of your joints from head to toe. I'm going to have you move your head back and forth and forward and backward, and then we'll do that with your arms, and then just move them back and forth. Also checking your elbows, making sure that you have good range of motion. I'm going to go ahead and check all your fingers and make sure that they have good motion and that you don't have any joint issues. All right. And then also I'm going to have you do your hips, where you're back and forth. And then I'm going to have you march in place. And then I'll have you sit and I'll have you stretch out your legs. Go ahead and sit on the table. Go ahead and stretch your legs out. We're just checking your flexion and your extension here. All right, and then I'm going to have you do this with your ankles. Go ahead and push on my hand and then pull back towards yourself. All right, same with this one. Push and then pull back towards yourself. All right. And then I'm going to go ahead and check your toes, make sure that the joints are all good there. Alrighty. We're going to go ahead and check your lung area. What I'm going to do is just check your thoracic region first, and I'm just checking your respiratory pattern and making sure that there's no visible issues there, making sure that there's no masses, and I'll just go ahead and palpate and make sure that there's nothing that I can feel or see that would be abnormal or concerning. All right, I'm gonna come around your back. I do need this to measure because what I'm going to do is measure your diaphragmatic excursion. So what I'm gonna end up having you do is I'm going to percuss, and I'm going to have you breathe all the way out and then hold your breath as I percuss on your back. And then I'll also have you blow all of your air out and then hold it, and then I'll percuss from the other way. So first I'm going to have you go ahead and take a breath and blow all of your air out. And just hold it, hold it, hold it. All right, go ahead and breathe out. And I'm going to measure from the other way. Go ahead and take a deep breath and hold it. All right, go ahead and breathe. I'm just going to go ahead and measure this here. And it is about 5 centimeters, which falls into the normal category there. All right. I am going to go ahead and auscultate your lungs. And I'll do that bilaterally. Just go ahead and breathe regularly. Take a deep breath for me. All right. Excuse me just one moment, please. All right, sorry about that. All right, we're gonna go back to checking your lungs. Go ahead and take a deep breath for me. All right, deep breath again. And again. And again. And what I'm doing is just going back and forth and checking his lungs bilaterally. Go ahead and take a deep breath. And deep breath again. All right, excellent. Another thing that I'm going to have you do is I'm just going to palpate, and I'm looking for tactile fremitus. So just go ahead and repeat 99 over and over again until I let you know, okay?
Okay. 99, 99, 99, 99, 99, 99, 99, 99.
All right, excellent. Thank you so much. All right, another part that we're going to go over is your cardiovascular system. What I'm going to start with is just inspecting, looking for any heaves or anything that would be abnormal. I'll just palpate around. What we'd be looking for is any murmurs throughout this assessment. I'm also going to go ahead and auscultate. And first I'll start with looking over your aortic region, which is in the second right intercostal space. So we'll go right over here. And then we'll go over to the pulmonic region, which is over on the second left intercostal space. And then we'll move down to Erb's Point, which is in the third left intercostal space. And then down to the tricuspid, which is in between the fourth and fifth left intercostal space. And then over to the mitral. Then also with this assessment, what I'm going to do is check a few of your pulses. I'll check with your temporal pulse here, making sure that you've got good pulses. Going to go ahead and bilaterally check just go ahead and relax those, your brachial pulses. Your radial pulses. All right, and then I'll check your popliteal pulses, which are right behind in the back of your knee here. All right, and then I'll check your posterior tibial pulses, which are on the back side of your foot. And then your dorsalis pedis pulses, which are right on top of your feet. All right. And you do have good pulses. So what I'm going to do is go ahead and move on to your abdominal assessment. I'm going to go ahead and have you lay out on the table. And I'll start with inspecting, just looking again for anything that is abnormal, any masses, anything that sticks out to me, anything that, just looking at your vascular pattern, looking at your umbilicus, looking at just multiple different areas on your chest here. So we always start with inspecting, and then I'll go ahead and move on to auscultation, okay? So what I'm going to do is go ahead and listen to your bowel sounds, and I'll listen in the right lower quadrant, and then just go ahead and move into a clockwise fashion. Right, and your bowel sounds are normal, active, and audible, which is fantastic. I'm also going to listen over a couple of your arteries. I'm going to listen over your renal arteries and then your iliac arteries, which are just a little bit lower here. So I'm actually going to listen with the bell. I can hear those a little bit better there. And then I won't listen to the femoral arteries today. All right, I am going to go ahead and listen over a couple of your organs. I'm going to listen over your liver, which is on your right side here. And then I'm going to listen over your spleen, which is on your left side over here. All right, and then your kidneys here. All right, now we're going to do some percussion. What I'm going to do first is go ahead and just measure your liver over here, and I'm looking for or listening for the tympani and dullness as I measure this, okay? So just go ahead and relax, and I'm just going to percuss over your liver here, okay? Okay, perfect. So it's about right here, and then it was right here. So I'm just going to go ahead and measure that. And it is about 10.5 centimeters, which does fall into the normal range there. I'm going to go ahead and percuss over the spleen. All right. And now that I've done the inspection and the auscultation and the percussion, now I can go ahead and palpate. What I want to do is just palpate over your liver here. Just making sure that it's that normal size. All right, I am going to have you roll a little bit onto your right side so that I can get up under your rib cage to feel your spleen. All right, very good. Go ahead and lay on your back. I'm going to palpate over your kidneys. All right. Very good. I'm going to have you go ahead and sit back up. And there's a few other assessments that I'm going to have you do. I'm going to have you turn this way. And I'm going to just do a few position senses. And this is with the musculoskeletal area here. I'm going to have you close your eyes. And what I want you to do is tell me if I'm moving your finger up or down, okay?
Up. Down.
All right. And we'll do that bilaterally.
Down.
All right, very good. And I'm going to do that with your toes as well. Go ahead and keep your eyes closed.
Up. Down. Up.
All right, and I'll do that bilaterally as
Up.
well.
Down. Up.
All right. And then we're going to do a test called stereognosis, where I'm going to have you hold your hands out, and I'm going to have you close your eyes, and I'm going to put an item into your hand, and you'll just let me know what that item is. You can go ahead and feel it when I put it into your hand, okay?
Okay.
All right, go ahead and feel it.
Comb.
Yes.
Keys. Fingernail clippers. Keys.
All right. And then we'll go ahead and do another test, which is called a graphothesia test, which I'm again going to have you go ahead and close your eyes. Just keep them closed. I'm going to trace a letter or number into your hand, and you just let me know what you feel, okay?
M.
All right.
S. 8.
All right. There. All right.
S. 8. M.
All right. Very good. I'm also going to have you, again, go ahead and lay back down because I need to do this vibration test. And what I'm going to do is have you just stretch out your legs here, sorry. All right, I'm going to just have you let me know when you can no longer feel the vibration. I'm going to put this on a bone on your toe, and I'll be feeling it on the other side, but I just want you to let me know when you can no longer feel it.
No.
All right, and then we'll do your other toe.
No.
All right, very good. Go ahead and sit back up. I'm going to do a test just feeling your light touch and your pain sensation. So I'm going to go ahead and have you go ahead and close your eyes again and just say yes whenever you feel this touching you, okay?
Okay.
We're doing the touch first.
Yes. 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 Yes.
And we'll do that bilaterally.
Yes. Yes.
All right. And then just let me know if you feel this as well.
Yes. 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 Yes.
All right, very good. All right. We're also going to go ahead and test a few of your deep tendon reflexes, okay? So what I'm going to start with is probably do your brachial reflexes first. I want you to go ahead and flex your arm so that I can go ahead and find this really well here. All right, there you go. Go ahead and relax now. All right, and I'm just going to go ahead and check your brachial reflexes right now, okay? All right, and what I'm looking for is this flexion here. And I did see a good flexion. I'm going to try that again. There we go. And it was a good, very good reflex right there. I'm going to go ahead and check on the other side. Go ahead and flex for me again so I can find that really good. All right, go ahead and relax. Just go ahead and keep that relaxed there. I'm going to try one more time. There we go. And I did see a flexion here. All right, now we're going to go ahead and do the tricep. I'm going to have you dangle this and just keep it nice and relaxed. All right, and we're going to go right here. All right. That was a good one. We'll go ahead and check on this other side here. These are checking your triceps. Just finding the tendons. All right. And then we'll do your brachioradialis. I'm going to have you just keep that hand relaxed there as much as you can. There we go. And check over on this side, just finding that tendon in your wrist there. I'm going to try that one more time. All right. And then I'll go ahead and check your popliteal reflexes here. Just keep your legs nice and relaxed. All right. And then I'll check on this side. I'm going to check that one more time. Get a nice reflex there.
Oh, that's trippy.
All right, now we'll do the ankle reflexes right here. Just find the tendon in the back of your ankle. All right, and there was a nice reflex right there. The muscle or tendon just tensed up there. There we go. All right, very good. And I think that's all that we're going to cover for today, okay?
Okay.
I am going to go ahead and swivel this around the room here and make sure that you can see the table. I can't see it real good.